So then it's a pleasure to introduce a longtime friend and colleague and co-worker, Professor Grethe Myklebust, who will be talking about the first step in this model. I cannot see them. There you go. Injury surveillance. Grethe?
Should I use the mic?
Oh.
This one? Okay, thank you very much, Roald. Can you hear me? Good. Now I will try to say something about the team injury surveillance. And if you're a team physio or a team physician working with, for example, a national team, and I took the possibility to show the Norwegian male national team because they are not here. They are not qualified for the World Championships, so this was the only possibility to bring Norway in. But if you work with the team, you have a lot of possibilities to follow them and to know what kind of injuries they have if you are there together with them. When you are on your training camp, your championships, you follow them closely and you know what happens with them. You talk with them and see all the acute injuries, and hopefully they tell you about overuse injuries. But what about players like this? Most of the best players are not playing in the country they played for the national team. For example, Heidi Løke is playing in Hungary. She's one of our best players in Norway on the national team. The same with the male player here. They don't play in the same country as they play for the national team. And who sees the big pictures regarding their injury status? Who keep records and who keep their records? Who knows what happens in their team, where they use most of the time, compared when you have them on your national team? And who collects this injury information? Do the player have the information? I don't think so. They maybe remember what happened the last week, but if you ask them, did you have any pain problem or injuries 1 month ago? Maybe they don't remember. The team physician and physio, do they have full control over their injury situation? Maybe when you have them together with you, but I don't think there are a system that follows the athlete. So it's quite difficult to get knowledge followed from the club until the national team. And probably the coach, he don't know, or she don't know what the injury problems are. They get told from the health personnel, but they don't have control of that. And is there a central registry that follows the player, so you have all the information of the player all the time? It doesn't happen. A lot of clubs want to have it, but I don't think the national physician and the physio have the information from the club all the time. So it depends on a lot of telephone calls, emails to get that information. And could it be possible to have a system that captures both acute injuries and overuse injuries in an easier way? That's the question. And some injuries are quite easy to collect. For example, this knee injury, it's, of course, everybody get to know this injury because it takes a long time away from handball. It has long time consequences, and all of us will know about this injury. But what about pain problems? Of course, having a little bit pain in your shoulder and your back and everything is a part of the game. If you play top-level handball, you have pain problems more or less all the time. But at one time, these pain problems influence your participation, your performance. Then we have a problem. And how do we know about these problems among all the players in the team playing in Europe? Do you get this information to the national team health personnel? And regarding overuse injuries, which I will talk a lot about now, a lot of people talk about that we only know about the top of the iceberg, that the number that we have recorded is only the top of the iceberg, but probably the numbers of overuse injuries in handball is much bigger than we know. And just shortly remind you the difference between acute injury and overuse injury. The acute injury happens, and during some weeks or maybe months, the injury is healed, and you return to sport during some weeks, for example. But a more typical overuse injury looks more like this. It's fluctuating with better periods, and then you're getting worse again, and the tissue injury starts quite early, but you maybe don't feel anything. And here you have repeated episodes of overload, which influence the athlete a lot. And we know that a lot of athletes use medication to reduce their overuse problems to could function in a game. And the traditional surveillance method or model is that you probably, as we have here, 10 players. And we record, for example, for these 10 players, 8 injuries. And all of those give time loss in a short or a longer period. And if we think that these players practice 5 hours per week, then you have 1,000 hours of training. And you will have here an injury incidence of 8 injuries per 1,000 hours. And this is in the typical traditional way of counting injuries. And when you start doing an epidemiological study, you have to decide what kind of definition you want to use. And Fuller had a consensus statement, which was actually made for football, but is also used for most other sports. And all complaints is really broad definition, where all complaints that a player came with is a part of the registration. A more narrow way is all the injuries that needs medical attention. And the most narrow way of looking at it is the time loss injuries. And we know that most epidemiological studies that have been shown these days have presented time loss injuries. So most injury studies use time loss. And how does that work in overuse injuries? Because the pain often comes after the tissue injury has already started. After a while, the athlete have some reduced performance. It maybe have a little bit less participation, but it still continue doing their training and their matches. They are not out of play. They have no time loss. But there are a problem. The athlete has a problem. And when we look at those 10 players again, and you see here we have monitored the pain and reduced function for those 8 players, you see that only one player looking at this in this way will have time loss injury. So then we will have only one time loss injury, which give us an incidence of 1 injury per 1,000 playing hours. But at the same time, if you look at this period of time, 50% of the players will have pain and reduced function. So it's a large mismatch between the two ways of looking at injuries. And Ben Clarkson has newly published some articles regarding how we can use overuse methodology to get more knowledge about these types of injuries. And I will go through this Oslo Sport Trauma Research Center Overuse Injury Questionnaire. It's a long word, but it's something you probably will be well known after a while. And this questionnaire is an electronic questionnaire which we distribute to every athlete by email or more recently by an app. All the athletes are asked to respond regardless of whether or not they have problems. And in this test that we did with the Norwegian athletes, we focused on the predefined anatomical areas like knee, shoulder, and lower back. But of course, you can ask questions for the whole body, which Roald showed you in the his last slides. And we have 4 questions on injury consequences per area. The first question they get, and it takes them only maximum 2 minutes to answer. Have you had any difficulties participating in normal handball training or matches, for example, due to knee problems? Have you reduced your training volume? To what extent have the knee problems affected your handball performance? So now we are talking about performance. And to what extent do you have experienced knee pain related to handball participation? And by asking these questions, you have a possible number of 25 on each of those 4 questions. So we can have 100 as a maximum score. If you, for example, fill out like this, you will have a severity score for 60. And that will tell us that the athletes had quite large problems because they have moderate or severe problems with participation, and it reduces the performance. So that then we know that this is not a mild problem, a sore shoulder, a sore knee. It's really a hard and tough injury to get. And this is an example of an athlete. And you can follow them for every week they have answered. And you see that this is an athlete with large, big problems with their knee or their shoulder. And it fluctuates during the season. And probably this knee problem will influence the athlete's performance in a real way. And we wanted to test how this method, we used it in different sports and wanted to test how this method works compared with the time loss method. And we did the parallel injury registration with the standard method, the F-mark time loss definition, and used that. And we made the data collected from the coaches and physiotherapists in the teams. And then we used this method that I now showed you, the OSLC, Overuse Injury Questionnaire, was sent weekly to the same athletes. And we wanted to see how the numbers of injuries was recorded. And the question was, to what extent did the new method record a more valid reflection of the burden of overuse injuries in this cohort? And we had a really great response rate, as you see in these teams, a really high response rate. And the number of overuse problems in a knee, shoulder, and low back registered during using the 2 different methods was like this. And as you can see that the standard method using the time loss definition got these numbers of overuse injuries, while the new method got these numbers, which gives a large difference. So what this shows is that the standard method using time loss is hiding a lot of the overuse injuries. So we can actually say that we only see the top of the iceberg by using the time loss definition. And this is how it looks like when we look at all overuse problems for these 3 body areas. We got an average prevalence of 24% for the knee, 16% for the low back, and 12% for the shoulder. And when we looked at substantial problems, and substantial problems are more than a sore shoulder, it's really affecting the athlete because they have clicked on moderate or severe problems in 3 of these questions. So this is actually problems that really affect the athlete. And here you see the numbers for the different sports. You see handball, it's a lot of knee problems and shoulder problems, who is mainly the main problems regarding overuse injuries among these athletes. Here we see, again, it's easy to, when we look at this slide, you can see that handball knee problems are the main overuse injury, handball shoulder here, and then you can compare them to other sports. You see only volleyball knee overuse injuries are more prevalent than the handball injury. So back to our athletes. What's in it for them? Is this something they would like to use? this is probably something you would like to use and ask them to answer, because by having this questionnaire, sending them every week or every second week, you have a full control over how their overuse situation are. So you could control how they train. You can see when an athlete is closing to something that you think would end up in a timeless injury if you don't do something with the athlete. So it's a really nice way to follow the athletes, go in and try to get them some treatment before it's a really big problem. With this way, you can follow the athletes really close. So we will absolutely recommend you to try this out on your teams. And the question is, will the athletes use time for this? It takes maybe 2-3 minutes to fill out this, and I think it's worthwhile doing it. So for this part, we can conclude that the new method, it captures a more complete and nuanced picture of the extent and severity of overuse injuries in sport than the standard surveillance methods. And these methods can be used to monitor all types of health problems. As Roald said, also illnesses, not only injuries, but also illnesses in large diverse groups of elite athletes. And this can help you to control and affect the player's training load. So now back to you, Roald.